Hi, I'm Dr. Maria Lavia, an eating disorder specialist, child, adolescent, and adult psychiatrist, and director of psychiatry here at Equip. Today, I'm going to teach you how to do vital signs from the comfort of your own home. For our purposes, we're interested in taking something called orthostatic vital signs, which means we take blood pressure and heart rate both lying down and then again after standing up. The reason why we care about this is because malnourishment can cause a change in vital signs that, with position changes, can lead to things like dizziness or fainting episodes, and we need to make sure we're keeping our patients safe. We monitor these to make sure that you or your loved one are medically stable and safe enough to continue to participate in a virtual eating disorder treatment program like Equip. Sometimes we may partner with your primary care provider and send you back in to get in-person vital signs. That's something your medical provider at Equip will discuss with you if it's ever clinically indicated. As a first step, you'll need to obtain a blood pressure monitor and cuff. You may need a pediatric-sized cuff if the patient's arm circumference is less than 9 inches, or you'll need to size up if the patient's arm circumference is greater than 17 inches. Please refer to the handout sent by your medical team on the different options. If you do switch from the cuff that came with the monitor, you can take the plastic connector off the cord and place it on the new cuff so it will fit the monitor. Your medical provider will help guide you on how and when to take these vital signs, but ideally they should be taken on the day of or on the day before the medical appointment, prior to your visit with your medical provider. These should not be taken first thing upon waking or immediately following physical activity. To begin, the patient will lie down on a completely flat surface. Place the blood pressure cuff on the patient's arm above the elbow. To get an accurate reading, short sleeves should be worn that can be rolled up so that the cuff is on bare skin. The bottom edge of the cuff should be at least half an inch above the elbow, and the plastic tubing should be coming from the lower edge of the cuff. The cuff should be snug, but not too tight. You'll also want to make sure the plastic tubing is not tangled or kinked. Now that the blood pressure cuff is on, the patient needs to lie flat for 5 minutes and be as restful and still as possible during this time in order to get an accurate reading. We recommend using a timer to keep track of time. After lying for 5 minutes, it's time to check the blood pressure. You'll push the start and stop button on your machine. The cuff will begin to inflate, and the patient should lie as still as possible until the reading is complete. This generally takes about 45 seconds. When the cuff deflates, the numbers are visible and the reading is complete. Record the 3 numbers that you see on your machine on a sheet of paper. One number is the top blood pressure number, which is also called the systolic blood pressure. One is the bottom blood pressure number, called the diastolic blood pressure, and one number is the heart rate, also known as the pulse. If you get an error message, please refer to the instructions that come with your blood pressure machine, as it might give you an idea as to why the reading didn't work correctly, such as the arm cuff being too loose or the plastic tubing being disconnected. After recording the lying blood pressure and heart rate numbers, the patient should then stand up. Set your timer for 2 minutes. Some patients, especially those who may be orthostatic or have that big change in heart rate or blood pressure upon standing, may experience dizziness when they stand up. Any symptoms experienced should be noted and then relayed to your medical team. After 2 minutes have passed, repeat the procedure for checking blood pressure, this time with the patient standing up. Once again, you'll record those 3 numbers on a sheet of paper and also make a note of the time of day. Please document these results in a message to your med team chat channel in our messaging platform. Remember, if you ever have any issues or questions with conducting vital signs for you or your loved one from your home, please let us know. Your medical team will be more than happy to troubleshoot with you and answer any questions. Thank you so much for joining us here at Equip. We're excited to partner with you on your journey and look forward to working together to support you or your loved one to a full recovery.